Are you a carer or know someone who is a carer? A carer looks after someone who needs help with their day-to-day living without getting paid. A carer can be adults or children, and they look after a family member, a partner, or a friend because of disability, illness, mental health, frailty, or even addiction. They cannot cope by themselves without carers' support. We talked to Monica Dimanopoulos, Community Engagement Officer from Carers WA, to learn about carer and how their organization support their well-being. My name is Juan, and welcome to episode 10 of Building a Positive Community at Radio Melayu Perth Community HQ, supported by Office of Multicultural Interest, OMI.
So Carers WA is a not-for-profit community-based organisation, and we're the peak body looking after the wellbeing of carers. So we have two main roles. We are the voice and advocate on the carers' behalf, but we also provide services directly to carers as well. Yeah, so I suppose there's no typical carer, and we look after carers aged from 8 well into their 90s. And we look after anyone who is looking after a loved one who's living with a disability, mental health challenge, long-term medical condition, substance dependency, or someone who's frail aged as well. So our biggest challenge as an organisation is probably people identifying as a carer, because often people just chalk up what they do for their loved one as something they just do. But the roles of a carer and being a mother, father, partner, sibling, and being a carer are intertwined, but they are two different roles. And we need to distinguish between those two roles because there are different considerations in terms of the responsibilities too, and being able to identify as a carer. There are 2.65 million carers in Australia and 235,000 young carers. And by young carers, I mean carers aged between 8 and 25 years old. And the highest amount of carers are female with an average age of 50 as well. And so I've also got some stats from the National Carer Survey. And so those caring for a parent or parent-in-law is about 23%, caring for a partner 37%, caring for a child 45%, and caring for a sibling 5%. Range from emotional supports to practical supports. So it might be that you're looking after an aging parent, taking them to medical appointments or helping them make decisions. Or you may be looking after a partner who has a long-term medical condition and then maybe doing most of the domestic duties around the house. You could be making decisions on your loved one's behalf, helping them administer medication, any and all of those things that go above and beyond what other families may be doing for their loved one. Yeah, and you're absolutely right. So in a lot of cultures, the word carer doesn't exist or doesn't resonate because it's just something that you do. So that becomes a barrier in terms of, I suppose, coming and accessing our services as well. And often in a lot of cultures, things like Carers WA or My Aged Care or the NDIS don't exist. And often in collectivist cultures, it's the expectation that the children look after the parents as well. And that's fine, but there are services and supports there to help you with that role. Juggling a paid employment and unpaid caring role can be really hard. So at Carers WA, we've actually got a couple of programs to help with that. So first of all, we've got a carer-friendly employer program. And what this does is help organisations embed different policies and procedures within their organisations to help those employees who are carers. And I've got some stats about carers in employment as well. So of the 2.65 million carers in Australia that I mentioned, 70% of these are working age carers and that are employed, and that means 1 in 9 Australians that are employees are carers. And typically employees are more likely to become carers between the ages of 45 and 65 years as well. And that's why it's important to have these strategies in place to make sure that they are supported in terms of flexible working hours and retention too, because as we know, our population is ageing and more people will become carers as time goes on. We also have the Be Job Ready program, that's the other program. So that helps carers enter and re-enter the workforce. And what that program entails is 10 sessions that are typically around 2 to 3 hours each. And it helps carers identify certain skill sets, also help with development of resumes, interview techniques, and then also job search and technical skills as well. So there's a new federal government initiative that was rolled out about 18 months ago called Carer Gateway. And Carers WA is the lead service provider in WA for that program. And this program, the model is looking at early intervention and preventative support initiatives to help reduce stress and carer burnout, and then have long-term sustainable outcomes. So to try and put things in place so that carers are well supported, so they're not relying on ad hoc respite as a solution. And then I can go through some of the different programs within Carer Gateway. So there's a range of emotional and practical supports. So in terms of emotional supports, they have something called in-person peer support. And that's a 4-part training program which arms carers with skills on how to navigate the caring role. And they group carers in similar situations or circumstances to go through that program. And then if that group wishes, they continue on by themselves in that social setting. We also have, which is a brand new to Carer Gateway, is the carer coaching program. And that's different to in-person peer support because it's one-on-one with a carer coach. And it looks at any personal goals that the carer might have and then empower them to make any changes that they may wish to do in their own life. We also have counselling, and that can be done over the phone or in person at our Perth office on Lord Street. And then in terms of practical supports, we have carer-directed support, which are some financial support, but the funding is quite limited in terms of, if you look at the funding that's available through the NDIS and My Aged Care, it's nothing like that. But in terms of what we can offer is we can offer one-off practical support. So that's a one-off payment towards something that can be utilised by the carer that can directly contribute to their caring role or to access employment or education. So an example of this is we had a young mum caring for her 2 kids with autism, and she was trying to do some online training to help her access some employment, but she had a laptop that was really old, and so it kept crashing when she was trying to do her training modules. So we identified that as a strain in her life. So then we were able to fund a laptop for her. So that's an example of her being able to access training and employment, but also having those long-term sustainable outcomes as well. Now, the other financial package that we can offer is the carer director packages, and these can be used towards a range of practical supports and services. So it might be some domestic support like cleaning or gardening, or it could be helping with transport to medical appointments, or it could also be some planned respite as well. So in those packages, we've also been able to fund things like some yoga classes and some gym classes, if that's identified as kind of not a traditional form of respite, but just allows the carer to take a break from their caring role. A good example of the carer director packages is we had a young carer who was 14 years old, and he was looking after his father who was living with a physical disability. So he was doing everything around the house. Obviously, he was at risk of dropping out of school because of his caring responsibilities as well. And when our planners spoke to this young person, they identified two things. So one, he wasn't sleeping very well because he was 6 foot tall on a tiny single bed, and that was affecting his schoolwork as well. But also he and his father weren't eating very well. So they were not eating nutritious foods, which can also have an impact on how you, doing at school as well. So what we did is we bought him a new double bed, but we also put in a HelloFresh meal kit delivery service so that the young person and his father could then not only eat nutritious meals, but learn how to cook at the same time. So again, that's looking at those long-term sustainable outcomes rather than those short-term ad hoc respite solutions. In saying that, we can also provide some emergency respite to carers, because sometimes things just happen and carers do need to step away temporarily from their caring role. And if there's no one else to step in to help, then we can possibly help. And an example of that is if they get injured and need to go to hospital, or if there's risk of breakdown in the relationship due to stress, then we can perhaps step in. But I do want to say that it's not a crisis service. So we have 72 hours to implement the emergency respite. If it is a crisis, then they do need to call 000. So these are all the services and supports available through the Carer Gateway initiative. And then Carers WA, we've been around for 25 years, so we've also got some existing programs that we've had for a long time that we can also put in place in addition to these programs we have throughout the Carer Gateway service. So that's things like the employment program. We also have lots of workshops throughout the year, north and south of the river. So there's things like manual handling, compassion fatigue and boundary setting. And we also have workshops such as yoga, meditation and restoration as well. As I mentioned, we've also got the Young Carer program too. And then we also have a carer representation program where we help reps go on advisory boards and committees and represent carers in terms of like policy change at the government level. So what the carer will do is they'll ring us at Carers WA and we'll book in a planning session for them, which is done over the phone, and that typically takes about an hour. And we look at all facets of the carer's life in terms of their caring role. So we might look at their caring role, how they're coping at home, their health and well-being, work and finances. And then we create a holistic action plan of services and supports to alleviate any stress or strain in any areas of their life. Yeah, first of all, it's okay to ask for help. So don't feel guilty or feel like you're failing in your caring role. Every caring role is different. And so, like I said, it is okay to ask for help. It's really important to look after yourself and ensure that your health and well-being is good. Because it's like that analogy of being on a plane. The flight attendant will always tell you to put your oxygen mask on first. And that's important for survival, because if you run out of oxygen, you can't help anyone else with their mask. And if you don't look after your health and well-being, then you're at risk of burnout, stress, fatigue, inability to sleep, all of those things. And then you won't be able to care for your loved one at the level that you want them to be cared for. So asking for help, but also creating positive support networks. And by that I mean support networks of people and services that are designed just to look after the carer, not their loved one that's being cared for. So this could be a mix of people and organisations. And supports can be formal, but they don't need to be. So what you can consider as a carer is think about, if you're feeling overwhelmed or down, is there someone that I can turn to? If I'm behind in some housework, who can I turn to assist me? If my loved one becomes sick, is there anyone else that, or if the carer becomes sick, is there anyone that can step in and help look after their loved one? If they feel like being social, is there someone they can call for a coffee? So just thinking about these things, and if there are any gaps, then we're here as Carers WA that can help you fill in those gaps with different formal services and supports. And by formal services, I still mean like we have social support groups that we can link you into. We can help with some domestic duties around the house if that's an area of strain as well. Yep, so they can go on our website and have a look at some more information. On our website, we've got the Carers WA number, which they can call. And once they call us, we book them in for that planning session, which is done over the phone. And that's very much a two-way conversation, just so we can get an idea of their situation and use that as a guide to create that action plan. And if there's any service providers that are listening, they can use the referral form that's on our website as well.
Hope you get something out from the interview. We are about building a positive community and recognize that carers play a critical role to support those who cannot cope themselves physically and or mentally. We would like to thank Monica and Carers WA for the cooperation. This is the last episode of Building a Positive Community series. On behalf of the team at Radio Melayu Perth Community HQ, we would like to thank Office of Multicultural Interest for the trust in supporting the project. We also would like to thank all the guests who are willing to spend their valuable time appearing on our shows. Thank you also to everyone else who supported in various other ways. We apologize for any shortcomings. We hope this is the beginning of a more series in the future where we can get more participation from the communities. Thank you, see you again, and take care.